Good afternoon. I'm pleased to be here with Chief Medical Officer of Health, Dr. Deena Hinshaw, to announce a positive step forward in Alberta's fight against the COVID-19 pandemic. Alberta's response to the coronavirus continues to go very well. The province-wide total daily numbers of reported cases peaked at 336 on April the 23rd and has been declining ever since. The growth curve has successfully been flattened in most of Alberta. We must, however, remain careful. We must continue to take all the small daily precautions to keep the spread of the infection low and to protect the most vulnerable amongst us. This includes all the things you've heard 1,000 times: washing our hands frequently and thoroughly, sanitizing frequently touched surfaces, wearing face coverings in crowded places, respecting physical distancing, and staying home if you're feeling sick. Having said that, new cases are still appearing every day, with the hardest hit communities being parts of Calgary and Brooks, which together account for 3/4 of Alberta's current COVID-19 cases and hospitalizations. New cases will continue to appear even as we keep the infection rate low and well within the capacity of our hospitals, especially the intensive care units. The strongest measure of our success in containing the virus continues to be Alberta's low hospitalization and ICU admission rates. The probable projection in the April 28th modeling projected that hospitalizations would peak at 600 COVID patients in mid-May, while ICU admissions were expected to peak around 190 at the same time. Instead, combined hospitalization and ICU admissions so far peaked at 96 on April the 30th and have been falling since. Today, there are 70 Albertans being treated for COVID-19 in hospitals and only 11 in intensive care. The most encouraging news of all is the surging number of recovered cases. The number of recoveries has surpassed the number of active cases, and they did so at the beginning of May. And the gap between those two numbers has been growing steadily, and that's very good news. We now have more than 5,000 recovered cases compared to 1,100 active confirmed cases in the province. So recovered cases now outnumber active cases by about 4 times. We have seen nearly full recoveries from some of our largest outbreaks, including at the Cargill and JBS packing plants. While the ratio of active to recovered cases in Calgary and Brooks is lagging that of the rest of the province for now, Edmonton is currently recording only 53 active cases against well over 400 who have recovered. And large parts of central Alberta are reporting almost no active cases whatsoever. All of these numbers add up to a very successful stand so far against COVID-19 in Alberta. This is in thanks in part to the great efforts of our public health professionals in delivering one of the world's most effective systems of COVID-19 testing, tracking, and tracing. But above all, these results reflect the discipline shown and the sacrifices made by millions of Albertans, all of it to protect the most vulnerable amongst us, like the elderly and those with underlying health problems. So today, I am pleased to announce that thanks to your efforts, we are proceeding with Stage 1 of Alberta's Relaunch strategy. On the advice of our public health officials, we will be taking a gradual regional approach to reopening for certain activities that require greater physical proximity. Dr. Hinshaw has flagged 2 specific areas, Calgary and Brooks, where we continue to see a disproportionate number of cases. Together, they account for 3/4 of our current cases of COVID-19 and hospitalizations. As such, we've accepted the Chief Medical Officer's advice to have a slightly slower, phased relaunch in those 2 communities. This is consistent with the regional approach that we said might be required when we first announced our relaunch plan a couple of weeks ago. So starting tomorrow, a wide array of businesses and facilities will be able to reopen in most of Alberta, including retail businesses like clothing, furniture and bookstores, along with all vendors at farmers markets, hairstyling and barbershops, museums and art galleries, more scheduled surgeries, dental procedures, physiotherapy, chiropractic, optometry, and similar services, and daycares and out-of-school care and day camps, including summer school with limits on occupancy, restaurants, cafes, pubs, and bars with seating at 50% of their legal capacity. Post-secondary institutions will have more flexibility for course delivery, including in-person or in combination with online learning. And places of worship may reopen their doors, including for funerals, under strict guidelines. The lifting of these restrictions is in addition to those announced at the beginning of the month, which included the reopening of golf courses, boat launches, and private and municipal parks, sports fields, outdoor courts, as well as playgrounds, and the resumption of scheduled non-urgent surgeries, along with services provided by some regulated health professions as long as they follow approved guidelines from their professional colleges, like the dentists. And the reopening of provincial campgrounds with some restrictions, including for overnight camping at some parks starting June the 1st and most others by June the 15th. In Calgary and Brooks, these initial restrictions were also lifted and will remain lifted, but the complete Stage 1 relaunch will be phased in over a 2-week period. Starting tomorrow, Calgary and Brooks will join the rest of the province, allowing the following to operate under public health guidelines: retail businesses like clothing, furniture, and bookstores, all vendors at farmers markets, museums and art galleries, as well as daycares and out-of-school care with limits on occupancy. Then, starting 11 days from now, starting May 25th, hairstyling and barbershops will be able to reopen, along with cafes, restaurants, pubs, and bars at 50% capacity. And then finally, on June the 1st, the remainder of the Stage 1 reopenings may occur in Calgary and Brooks, including day camps, including summer school with limits on occupancy, post-secondary institutions for in-person or combined online course delivery, and places of worship, including funerals, again, under the guidelines. These businesses and organizations will have a little extra time to prepare for safe reopening while our public health experts continue to monitor the data in those communities. Detailed information and guidance for businesses, nonprofit groups, municipalities, and individuals on how to safely resume all of these activities is available on the Alberta Biz Connect website. All of the reopening activities will still be subject to the legally enforceable orders of the Chief Medical Officer, including, in most settings, the 2-meter physical distancing and 15-person social gathering restrictions. Now, I know that many folks in Calgary and Brooks will be disappointed that reopening will take a little bit longer for things like restaurants, hair salons, and limited worship services. But we didn't take this decision lightly. Our fight against COVID is going in the right direction across the province and in Calgary and Brooks. And barring an unforeseen spike in new cases or hospitalizations, we should be able to stick to this slightly more gradual schedule. But Dr. Hinshaw and her colleagues are concerned that we continue to see significantly more cases of community transmission with unknown sources in Calgary and Brooks as compared to the rest of the province. So we are prudently giving our public health experts a little more time to monitor trends in those communities. Better to be safe than sorry. So let me be clear. No one should suggest that Calgary or Brooks are in any way unsafe. That would be wrong. The number of active cases in Calgary is only 74 per 100,000 people, compared to 29 per 100,000 people province-wide. So the risk is low for Albertans wherever they live. And we are all in this together, regardless of where we live. Like the initial decision to close some businesses and restrict some activities, the process of gradually and safely reopening them has not been an easy one. It's an evolving process that will change as we learn more about the virus and about what can be done relatively safely and under what conditions. I want to remind Albertans that our province has remained far more open than other provinces and most other jurisdictions around the world. In fact, 85% of Alberta businesses, representing 96% of our province's economy and 88% of our workforce, have been allowed to stay open over the past 2 months. On top of that, we're moving more quickly to reopen before other jurisdictions, and we are doing so prudently to reduce the chance of a second spike that could force an even more damaging set of public health restrictions. So I know that for some folks, this will feel like we're moving too fast, and for others, will feel like we're moving too slowly. That's why I want to assure all Albertans that at every single step, these decisions are being informed and guided by data and by the best scientific and public health advice available. However tempting it is for Albertans in low-risk groups to relax your guard, please don't. Everyone who has symptoms of COVID-19 or who have had contact with infected people or who have returned from international travel will still be required to self-isolate. It comes down to relying, at the end of the day, on common sense and on all of us accepting personal responsibility, for managing the risks. Government can provide rules and guidance, but at the end of the day, it's the responsibility of each and every one of us to protect ourselves, our families, and the wider community. If we slack off, people in our community, and maybe people we love, will suffer. And if cases and hospitalizations spike, we'll have to reintroduce either regional or province-wide restrictions again. On the other hand, if we manage stage 1 reopening successfully, we'll be able to move sooner into stages 2 and 3 of our relaunch than would otherwise be the case, which will be vital to the future of thousands of businesses and our overall economy. Throughout each phase, there will be an evaluation and monitoring period to determine if we need to adjust restrictions up or down. We'll closely watch hospitalization and ICU rates in particular. Where hotspots and outbreaks occur, they will be closely monitored with widespread testing and tracing to manage them as we did in High River, as we're doing right now in Brooks and Calgary. Once again, I want to encourage all Albertans to download the Alberta Trace Together app. It'll be very helpful for healthcare workers to track and isolate infections, stamp out local outbreaks if they occur, while giving us more confidence to move the future to the next stages of the relaunch. Alberta's government is doing everything within its power to curb the spread of COVID-19. The measures we have put in place are there to keep Albertans safe and to get us all across the finish line. We can see these measures are working. Albertans have demonstrated a tremendous level of personal and civic responsibility in the face of an unprecedented threat to our well-being. So congratulations to one and all for our success so far. I'm confident that we will move through the next stages of the relaunch strategy with the same unity and resilience that we've shown since day one of the pandemic. So with care and common sense, we will move forward together. Thank you, and now I'd like to invite Dr. Hinshaw to offer her remarks.
Thank you, Premier, and good afternoon. I will begin today's remarks with my regular update about cases, and then speak further to today's relaunch announcement. In total, there are now 5,076 people who have recovered from the virus, leaving 1,211 active cases in Alberta. Currently, 70 people are hospitalized with COVID-19, with 11 of those admitted to ICUs. In the last 24 hours, out of 4,072 new test results, there were 62 new cases. An outbreak has now been declared at the Horizon Work Camp operated by Canadian Natural Resources. There have been 5 confirmed cases linked to the camp, and the operator is working closely with Alberta Health Services to limit the spread. We are announcing this outbreak today as it has met the threshold of 5 cases. When there are 1 or 2 cases at a particular work site, that isn't considered to be proof of transmission at that work site, and therefore the public disclosure does wait until 5 cases where it does seem that there has been on-site transmission. and that is the reason we're speaking about this today. Testing is being offered to all employees, including those without symptoms, and I'm confident that the spread can be contained on this site as all measures are being taken to do this. With respect to Relaunch, I would like to echo the Premier in thanking Albertans for their commitment to protecting one another. Thank you for the sacrifices that you have made, ones that only a few short weeks ago would have seemed unimaginable. Make no mistake, there have been sacrifices. Lives, lifestyles, and livelihoods have all been impacted. We've been physically distanced from those we love and care about, and I know how difficult it has been. We've missed birthday gatherings, postponed weddings, and celebrations of life. And Albertans have responded to this unprecedented challenge with compassion and grace. They've found ways to connect with each other, to help one another, and to thank one another, with a particular focus on thanking those on the front lines. I know the last few weeks and few months feel like we have traveled a long and arduous road together. While our journey is far from over, I hope we can take a moment today to recognize what we have collectively achieved. We often think that one person's actions can't make a difference, but by following public health guidance, practicing physical distancing, washing our hands regularly, and staying home when sick, every single one of us has helped to save lives. Albertans should feel incredibly proud for looking out for one another and helping us to collectively move forward with this relaunch. As we move into stage 1, I know that many are experiencing mixed emotions: relief, excitement, anger, anxiety, and fear. But I want to assure you that protecting Albertans' health and well-being is at the forefront of every decision that is made. We would not jeopardize all that you have risked and sacrificed by beginning to reopen prematurely. I feel confident that it is the right time to move into stage 1. That being said, stage 1 allows businesses to open at the discretion of owners and operators. There is no directive to say they must open on a particular day. If an owner determines they need additional time to put appropriate measures in place to protect staff and patrons, I encourage Albertans to be supportive and not critical. These are difficult decisions that are being made to protect you and those around you. As I've said before, once businesses reopen, we want Alberta to stay open, and we want businesses to be successful and Albertans to stay safe. We have produced both general guidance for all settings and specific guidance for some sectors to outline measures that keep infection from spreading. We are also posting additional safety information, such as guidance that will be released today on how to flush water lines in buildings that have not been occupied for the past several months. We continue to work on guidance for other sectors as we get requests, and more information will be released as available and will be updated as any new evidence is identified. My advice will continue to be driven by data. Since before our first Alberta COVID case, the team of public health officials at both Alberta Health and Alberta Health Services have been closely monitoring and evaluating new cases, testing capacity, outbreaks, healthcare system capacity, and severe outcomes. This is not changing. We are taking a measured and gradual approach. If we need to provide government with advice to make community adjustments to the relaunch strategy, we will. This is evident in the more gradual reopening over 18 days that is planned for the cities of Calgary and Brooks. In these municipalities, we must recognize the higher number of cases we continue to see compared to the rest of the province. I know this may be frustrating for some residents and businesses, but we ask you to be patient. Your safety remains our top priority. And we encourage those in Calgary and Brooks to wait to access services in your communities on the upcoming dates, rather than traveling for services. I also ask all Albertans to be compassionate and kind with each other. We must avoid targeting individuals based on ethnicity or the city they live in, as the slower reopening there is a population measure and not an indication that all individuals from these areas have been exposed. If at any point we need to take a step back to protect the lives of Albertans in any region, we will make that recommendation. We do not want to go back. This is why we need Albertans to continue to do their part. It will take all our efforts to continue to keep our infection rate low and prevent a surge in cases that would require us to consider restricting movement and businesses again. As we begin to resume operations, our success will continue to be determined by the choices that each individual makes. Be thoughtful and intentional in your outings. Shop for what you need. Continue to look out for one another, such as shopping for someone who is elderly or vulnerable due to a medical condition. Take appropriate precautions, wash your hands, and continue physical distancing. I encourage anyone who is not able to keep a physical distance of 2 meters in a public place to wear a non-medical mask. We will be posting guidelines today to give more information to Albertans who are looking for details on choosing and safely wearing non-medical masks, and I encourage all Albertans to have a look at this new guidance, make sure that you are choosing masks wisely and wearing them safely. I also want to remind you of the importance of staying home if you are sick and taking the AHS online self-assessment to register for testing. You can download the AB Trace Together app to help AHS contact tracers, keeping yourself and others in the know if you have been exposed. By continuing to work together, we can keep each other safe as we begin to go out. Now is a safe time to relaunch. Thank you, and I'll take any questions that you may have.
For the benefit of those on the phone, we have Dr. Mark Jaffe from Alberta Health Services in the room to answer questions as well. Operator, can you please put through the first caller?
First is Rick Bell with the Calgary Sun. Go ahead, Rick.
This is a question for the Premier, and he may pass it off as well to Dr. Hinshaw, if he'd like. I'm, of course, calling from Calgary, so you can imagine the reactions down here. But it sounds like, Premier, you're talking about data, and it sounds like you told us the data is not bad anywhere in Alberta. It just happens that the numbers in Calgary are not as good as the numbers elsewhere. And you've also told us in the past and today that we should concentrate on what's happening in hospitals, which, as you know, as far as COVID is going, are largely empty. So my question to you is, how are you going to sell this particular decision to Calgarians, given the facts that you yourself have laid out? And number two is, did I hear right, or was it recommended that Calgarians stay in Calgary until, instead of access services elsewhere, until the 25th of May? Which probably won't happen.
Sure. Well, let me start with the last question first, Rick. We continue, as a general rule, to recommend against non-essential travel. The Chief Medical Officer has offered guidelines for people who are traveling to second homes, which is to try to stick to those second homes and bring groceries and supplies with them. You know, obviously, we were reopening provincial parks, and we expect a significant number of people are going to go enjoy the outdoors over the spring and summer weekends to come. So people aren't being told that they're locked in their homes by any means. City parks are open, provincial parks are open, and people have to travel for business purposes. And with the guidelines that the Chief Medical Officer has offered, people can travel to second homes, cottages, and the like. I think what the Chief Medical Officer just said was that she was suggesting that people wait to use services in their own community. And let's put this in perspective. We actually are starting with the Phase 1 relaunch in Calgary and Brooks tomorrow, with the reopening of retail services that will be there. It's simply things like limited church services, hairdressers, and restaurants that will have to wait for a few days longer to give our public health officials the time they think they need to be absolutely confident about reopening. Now, it's true that we're doing very well across the province. It's also true that the numbers have been much more problematic in Calgary and Brooks than the rest of the province. To give you some context, 940 active cases in Calgary versus 83 for the central, northern, and Edmonton health zones. So you've got more than 10 times as many cases in Calgary as central all the way up to the Northwest Territories. And similarly, in the South Zone, 110 active cases, and almost all of those are in Brooks. So what we really have are much more localized challenges, and I'll make no bones about it. It's been my hope that we could reopen things much more quickly right across the province. But I'm not going to let my own eagerness to do so to get in the way of the data-driven expert public health advice that we receive. And as I said earlier, it's better to be safe than sorry. I would say to Calgarians who are understandably impatient that the worst thing we could do would be to move suddenly on all of those fronts at the same time, and then have the chief medical officer come to us in a couple of weeks and say, well, we've seen a number of outbreaks of community transmission, the sources of which we cannot identify in Calgary, and I'm recommending that we begin clamping down again. What we're trying to do is to get to a gradual reopening where we don't have to move back and forth in terms of the policy. And so it seemed to me that it seemed to our Emergency Management Committee of Cabinet that the responsible thing to do was to accept the advice we were receiving, given the concerns that exist. And I'll invite Dr. Hinshaw to complement that answer.
Thank you, Premier, and I think you've covered the high points. I think the one thing that I would say, one of the examples that I provided last night as we were having this discussion, recognizing that it is a challenging decision, is the example of the state of Alabama, and we have been doing jurisdictional scanning to look at the experiences of other countries and other states who have moved into their reopening. And the data that my team provided me showed that in Alabama, they went from having a relatively low daily case count, and they opened their retail sector. And within 1 week of opening, they had their highest daily case count that they had had at any point in time, even before they began their relaunch. So I think what I want to emphasize is that we have slowed this by 2 10-day increments, with the understanding that Calgarians are going to be able to access all of those things the Premier mentioned, retail outlets, daycares, museums, outdoor recreation. That will all be accessible starting tomorrow, just the same as the rest of the province. But what I'm suggesting is that if Calgarians are interested in having their hair cut, they may want to think about going to their typical barber when that opens in 10 days' time, rather than traveling outside the city for that kind of service. And there's no legal restrictions on that. This is a recommendation. Again, just to emphasize that, as the Premier mentioned, we are recommending that people limit non-essential travel outside of the regions that they live in at this time. So again, recognizing that this is an inconvenience for Calgarians, it is so critical that we take a step where we do have these higher cases. We take a cautious step, monitor that, and make sure that we're not causing harm by opening too quickly.
Operator, can you please put through the next caller?
Next is Chris Bartow with the Calgary Herald. Go ahead, Chris.
Hi, Premier. 2 questions. The first one is, if everything goes according to, I guess, what your expectations are, when will you expect to see stage 2 and stage 3? That's the first question. The second one is, are you concerned separately with regard to Norway Sovereign Fund divesting from oil sands operations over the last 24 hours and the message that it might send?
Chris, on the first question, we are currently targeting no earlier than June 19th for phase 2. Once again, our public health officers will need time to study the data from the effects of phase 1. And if they do not see any problematic significant increase in the rate of infection or hospitalizations and ICU admissions, I'm hoping to get advice from them that we could then proceed by June 19 on phase 2. And I do want to underscore something, is for folks who are understandably impatient, to be blunt with you, I'm impatient to move forward, but I've got to have my impatience must be governed by the data and the public health advice. And that's the tension that we've been trying to get through as the Emergency Management Committee of Cabinet. And whenever I'm thinking of allowing my impatience to get the better of me on the decision making here, I just remember what the consequences would be if we reopen things too quickly and end up with significant second waves. That is, so it's best, like I say, better to be safe than sorry, better to do this gradually, and better to give our experts data to be sure that we're not that we're not losing all that we have gained through our sacrifices over the past 2 months. And that's a critical part. Like countless Albertans have lost income, opportunities, have gone through personal challenges, I'm sure many mental health challenges, and so much more, separation from loved ones, canceled weddings. There have been real serious sacrifices. And the last thing as Premier that I want to do is to waste the progress we earned through those sacrifices by acting rashly. And so we can be proud of where we are, but and let's also remember, very important to underscore this, that, look, I know there's a segment out there who would like us to take a zero risk approach and shut pretty much everything down indefinitely. That is not the approach that Alberta has taken. We have taken a thoughtful, prudent, data-based, incremental approach. We've done very well, and we've done it while having more of our economy functioning than any other province in Canada, and I think just about almost, with a couple of exceptions, any jurisdiction in the developed world. On the question of the Norwegian Sovereign Wealth Fund, to be blunt, I find that incredibly hypocritical. That entire sovereign fund owes its genesis to oil revenues coming from the North Sea reserves of Norway. And it's the pot calling the kettle black in this instance. Norway is actually engaged in exploring to develop new massive offshore fields to increase their production of oil. And so we're not going to be lectured to by a state sovereign wealth fund, 100% of whose primary revenues are generated by oil development. This, I think, underscores the hypocrisy that lies at much of the ESG discourse that's going on. And let me also say that it also underscores why we need to get our message out to European institutional investors. That's one of the reasons that we created the Canadian Energy Centre. And we continue to do important work on refining the data to support our contention about how Alberta has significantly reduced CO2 emissions from our energy sector. Just yesterday, our Minister of the Environment announced an equivalency agreement in principle with the federal government over methane emissions that will lead to even further emission reductions. So once we get past the pandemic, we will be fully re-engaging in our effort to tell that story to institutional investors in Europe.
Operator, can you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
When it comes to the relaunch, the specific dates, which businesses are covered and where, did the government follow all of your advice, or are there instances, large or small, where the government opted to go in a different direction?
I think that's directed to Dr. Hinshaw, because
Yeah.
As the Premier, generally the government does follow my advice, I have to say that, but Doctor?
Yeah, that was for Dr. Hinshaw, that's right.
Thank you. So what I would say is that the decision-making structure is the recommendations are brought forward from Public Health and discussed at the Emergency Management Cabinet Committee, and the decision that was announced today is one that I fully support.
Operator, can you please put through the next caller?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Hi, thanks for taking my question. I have a couple of questions I'll try to squeeze in, but I'm wondering what the threshold is for any kinds of reclosures, whether in a regional sense or across the province. What would it take for closure to happen? Is there a specific number of new daily case counts that would have to happen, or just a general upswing?
So there's some absolute thresholds, and then there's some contextual indicators that we look at. So the absolute thresholds are hospitalizations and ICU admissions. So an absolute threshold is if there's been a rise in hospitalizations of greater than 5% over 2 weeks, that is an absolute threshold that indicates concern. And if the ICU capacity in a particular area is occupied greater than 50%, that's another absolute trigger or indicator that's of concern. So those are the two absolutes. But those two, hospitalizations and ICU admissions, are what we call lagging indicators, which means that those numbers rise about 2 to 3 weeks after transmission events have happened. Because between exposure, it takes about, on average, it can take about 5 to 8 days for somebody to be sick, and it can take up to 2 weeks for that to happen. And then from the time someone feels sick, it can take another week or so for them to be needing to be in hospital if they should have a severe illness. So the reason that we have those absolute triggers is because we need to make sure we have health system capacity to manage increased cases. But the contextual factors we look at, if we should have sharp rises in a particular region of cases, particularly cases where we don't know the source. So if we're seeing community transmission, meaning that we have lots of cases where they weren't linked to a specific known source, then that is a concern. And so there's no absolute threshold for those numbers. We're looking at the reproduction number, so the number of new cases that an individual case generates. We're looking at the number of new cases in a particular region and the proportion of those that, again, come from unknown sources as the contextual factors that we would take into account when looking at the need to have a shift in our approach to any particular region.
Operator, can you please put through the next caller?
Next is Robert Tuttle with Bloomberg. Go ahead, Robert.
Yeah, hi, thank you. My question is, a lot of the oil sands companies have pushed up their maintenance work to the current time, including the Horizon site. Are you concerned that this increased maintenance is contributing to this, what looks like a growing outbreak in the oil sands? And have you asked the companies to do anything about that?
So I did have a conversation with the executives of companies that work in the oil sands and run large camps earlier this week, and had a conversation about the kinds of things that can be done in advance of having any cases, the prompt response when someone is sick on one of those camps, and then expectations around the management of cases, and in the event of an outbreak, what would be expected. And I think that the operators of these camps are all aware of the recommendations and guidance that we have from the ministry, as well as very detailed specific guidance from Alberta Health Services, including how to contact Alberta Health Services if they should have cases or suspect cases. No one had raised a concern about increased maintenance, so that I can't speak to specifically. But what I know is that of the one larger outbreak that we've had in Curl Lake, and now this smaller outbreak with 5 cases at the CNRL Horizon camp, that the companies have been absolutely willing to work with us at the ministry, with Alberta Health Services, and are working closely together with us to make sure that measures are put in place. And when you think about the thousands of people that go in and out of these camps on a regular basis, the fact that at Curl Lake we currently have 107 cases, and that's spread out over about 6 weeks time period in terms of new cases. Many of those happened much earlier. We've had a small recent cluster, but again, I think that it's a testament to the work that's been done to reduce spread. And at the CNRL camp, again, we have simply 5 cases. We will be doing extensive testing at that camp and making sure the camp has supports. But again, I think that there are lots of measures that have already been put in place and additional ones that go in place when a case is identified. And I think that that work is bearing fruit in the limiting of spread that we're seeing there. Yep.
I'd just like to add to that answer as well, just to amplify what Dr. Hinshaw was saying. Look, we have hundreds of oil field camps across the province, and I'm aware of two outbreaks now. So let's keep this in perspective. This is not a growing number of camps. This is very limited, and I think, if anything, it's a sign of our success to date. And I want to thank, as Dr. Hinshaw just did, the operators for being so careful about their pandemic readiness.
Operator, can you please put through the next caller?
Next is Laurent Theroux with Radio Canada. Go ahead, Laurent.
Yeah, question en français pour Monsieur Kenney. Monsieur Kenney, comment allez-vous vous assurer que les résidents de Brooks ou de Calgary n'iront pas voyager à l'extérieur de leur communauté?
Alors, c'est pas une excusez-moi, c'est pas une obligation, mais nous avons une recommandation générale pour tous les Albertains de ne faire pas les voyages non essentiels hors de leur région. Alors, ça existe, c'est une recommandation pour les Albertains dans tous les coins de la province. Cela étant dit, évidemment, nous avons, selon le conseil des fonctionnaires du santé publique, nous avons accepté une approche un peu plus longue pour les communautés de Calgary et de Brooks. Et nous faisons un appel pour les gens d'attendre les services comme les coiffeurs dans leur communauté quand ils seront disponibles le 25 mai. Alors, c'est un délai de seulement 10 jours pour certains services personnels comme les restaurants, les coiffeurs à Calgary et à Brooks. C'est un appel, une suggestion vraiment, tout simplement, d'attendre l'ouverture de ces services personnels dans leur communauté. Je crois que ce n'est pas trop inconvenable pour les gens pour donner nos fonctionnaires de santé publique quelques jours d'étudier les données à la suite de l'ouverture de la première phase.
Okay, we have time for 3 more. Operator, can you please put through the next caller?
Next is Alana Smith with Post Media. Go ahead, Alana.
Hi there. I just have a question for Dr. Hinshaw. It's a bit of a two-parter here. So first one is, obviously High River isn't included in this, just in terms of it will still be reopening alongside the rest of the province. So I wanted to know why that is, especially considering a lot of the folks that work at the Cargill meat plant also live in Calgary, so how that's going to work together. And my second part being just there were a lot of businesses here in Calgary that were preparing for the reopening. Maybe they bought supplies, maybe they had hired staff back on, stuff like that. So why did it take so long to come to the decision to not allow Calgary to reopen at the same time as other cities? Thank you.
Sure. So for the first question, when we looked at the data with respect to cases in High River, there had been a couple of weeks ago a higher number of active cases in that community, but most of those cases have now resolved, and the rates in that particular community at the moment are not significantly higher than the rest of the province. So in High River, the data didn't indicate a need to have any kind of a differential opening. With respect to the time it took to make the final decision, I want to say I absolutely recognize the inconvenience for businesses, and the challenge that we're facing is the need to make decisions with the most up-to-date data, which unfortunately makes it challenging to give a lot of lead time. I want to encourage Calgarians who want to support their local restaurants to consider takeout options. Many restaurants still provide that, and so restaurants that maybe have ordered in extra supplies or extra food to get ready for the potential opening tomorrow, that takeout option maybe can be the way to use up those supplies, and so would encourage Calgarians to consider supporting local businesses in that way. And with respect to, again, other businesses that may have been moving to hire staff, again, I think absolutely acknowledge that that's the inconvenience, but if we had made a decision about relaunch much earlier, we wouldn't have had the benefit of the most up-to-date data. And that's why we, unfortunately, again, for planning purposes, are making the announcement so close to the actual relaunch date. I do want to emphasize again that the delay between stages 1 and 2 is just 10 days, and the phase 1 and 2, and then with the June 1st opening of the other services such as expanded ability for places of worship to have services. And so the hope is that that 10 days will be fast enough to allow Calgarians and those in Brooks to see what's coming next, but at the same time allow us to monitor the data and to make sure that these additional openings don't cause surges in cases that could be problematic.
Operator, can you please put through the next caller?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this is for Dr. Hinshaw and the Premier. Quebec is asking its citizens to wear masks when they leave the house, whether they are going to crowded places or not. So do you recommend the same thing for Albertans? Does that change depending on whether they are in Brooks or Calgary? And the Premier, you had mentioned before a non-surgical mask program. When can people expect them and how will they be distributed?
So maybe I'll take the first question, and that's to say that my recommendation is that if Albertans are leaving the house and going somewhere where they will be within 2 meters of someone else, that they should be wearing a mask, a non-medical mask. And what I think is really important to underline, though, in that recommendation is that masks are in addition to public health measures, not a replacement for. So I want to be really clear that even if someone is wearing a mask, it's still really important to try to maintain that distancing as much as possible, because I think there may be a mistaken impression that if a group of friends want to get together and have a party, as long as everyone is wearing a cloth mask, they can do so and there's no problem at all. And I think a cloth mask or a non-medical mask can be helpful to limit the spread of infection from the person who's wearing the mask to others. But it isn't perfect. It is an addition to, and again, not a replacement for. So that would be my recommendation. And with respect to the program, I'll let the Premier speak to that.
So there are really 2 stages to the program to support people with masks. The first part, we've been operating since the beginning of the pandemic to offer masks to essential service workers in various settings like seniors' homes, nursing homes, firefighters, first responders, essential service workers. And to date, the government, through the Provincial Operations Centre, has issued 2.6 million procedural masks to, as well as 1,895 masks to those essential service workers. Now, we have the larger public program for masks will begin at the end of the month. We have 40 million on order that we expect to receive in a couple of weeks, and we'll be making an announcement closer to the date about a distribution program. Now, let me be clear, there's no way that we can provide free masks to 4.4 million Albertans for every day indefinitely. Like it's impossible to get that much product with the whole world ordering and using masks right now at unprecedented rates. So, but we will be able to provide a limited number of masks for people for the foreseeable future that can help them if they're going out. For example, on their weekly grocery shopping visit, or if they have to take public transit and they don't have another face covering. But we also recommend, as Dr. Hinshaw said at the beginning in her statement, that people try to produce their own, for example, cotton masks or face coverings, and she is putting guidelines online on how to do so. There are many countries around the world, like Austria and the Czech Republic, where they've had very big, just volunteer community initiatives to make masks, to hand them out to the elderly, et cetera. And so we encourage Albertans. A lot of people have already been doing things like that. I've seen, seamstress shops and people who run businesses for window coverings and the like that have been converting their operations to sew and prepare masks for their neighbors, sometimes free, sometimes at a cost. I put up a video the other day about the reserve up at Fish Lake, I think it's the Big Fish First Nation, that has done great work converting from manufacturing overalls for the oil sands work camps to producing tens of thousands of masks. So there's a lot of domestic supply being generated out there, but we will be bringing on board about 40 million masks and distributing those beginning at the end of this month.
Okay, Okay, we have time for one more. Operator, can you please put through the last caller?
Final question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Premier. I'd just like to follow up on some remarks made by Dr. Hinshaw a little earlier, and I'd like to get her response to this as well. She was commenting on the idea that this announcement is coming pretty late in the day, considering tomorrow hundreds of Calgary businesses were preparing to reopen. She said that it took time to come up with these decisions, but presumably you've known for at least a few hours, right? Could there not have been a way that you could have given these businesses a hand? Businesses that have bought all sorts of perishable goods ahead of these reopenings, milk that they're going to have to throw out? Like, why did it take so long? Why did this have to come at 4 o'clock in the afternoon?
Well, this decision wasn't made until last night around 9 p.m. at the Emergency Management Cabinet Committee. And then we had to prepare for today's announcement. We also did inform in advance the relevant mayors and certain other key stakeholders. And so I wish we could have given people weeks of notice, but this thing is all moving much more quickly. And here's the reality. We could take a much more cautious approach than we are, I suppose, and just delay phase one across the province for weeks or indefinitely. But we want, as soon as we have the confidence with the most recent set of data that we could move forward based on the framework that we outlined a couple of weeks back, we wanted to move forward with that. So I'm very much regret if any businesses have gone to expense. We made it clear when we outlined the relaunch strategy a couple of weeks ago that nothing was for sure. That would all depend on the numbers and on the public health advice that we receive. So here's the good news is that we now have a clearer framework. We're looking at a slightly more gradual approach for some kinds of businesses in Calgary and Brooks over the next 10 to 14 days. And I'd just like to reiterate what Dr. Hinshaw said. And if, for example, people have ordered inventory, I hope that folks can support those businesses through example, takeout orders and the like. We are also our government has also provided extraordinary business support for employers across the province, as has the Government of Canada, and we're considering additional levels of support to ensure the future of Alberta employers. And
thank you. I would agree with that. And the only other thing I would add is just that the risks to opening too quickly and then having to rein back in again would also be quite damaging for businesses. And so ultimately, again, the recommendations are what I consider to be the weighing of all of the risks and taking the path that, again, gives the best chance of a safe and appropriate reopening time for those places in the province that are seeing higher rates with more of that unknown source spread.
Okay, thanks very much, everyone. We'll be back tomorrow with another update.